Good evening. It's a pleasure having all of you joining today, and we're really excited on embarking on this webinar, which is going to discuss the ALTIUS advantage in the realm of traumatic brain injury and neuro-optometric care. Now, let me introduce you to our distinguished speakers. First up, we have Dr. Heather Webster, a concussion specialist. Webster's expertise has significantly impacted her field, particularly in addressing post-concussional syndrome. And joining her is someone instrumental in the practical side of our discussion, her billing coordinator and office manager, Coreena Weber. Tonight, our focus goes beyond theoretical concepts. We're here to explore real-world applications of ALTIUS while also delving into the realm of billing and coding, which is a crucial aspect of every optometry practice. Dr. Webster and Coreena will unveil the complexities and offer practical insights into how ALTIUS can seamlessly integrate into your practice. And remember, your participation is key. You can submit questions throughout the presentation by clicking the Q&A icon in the taskbar. We'll read through all the questions at the end of the lecture. So let's get ready for this insightful evening. And without further ado, let me hand it over the virtual stage to our first speaker, Dr. Heather Webster.
Hello, everybody. Thanks you guys for joining us tonight. I'm super excited about talking about the webinar tonight, what we're going to be talking about with ALTIUS. Just a little bit of background about me. I actually had a private practice that I owned for 15 years. For about 10 of those incorporated into my practice, I was also in conjunction doing brain injury patients. So I was incorporating it into my day-to-day primary care practice. The last 2.5 years, I have gone and sold my private practice. Now I do almost exclusively brain injury. So that's pretty much my main focus now. That's what I've been doing the last few years. Coreena is my billing specialist. She's been doing that for about 4 years. She did that for me some at my primary care office, and also she came with me now to my new practice. So I want to kind of go through some of the things about how I got into that, how you might be able to utilize some of the things I know in your own practice. And especially being able to try to utilize the ALTIUS to maximize your patient care and your business. So I'm going to go ahead and get started here without further ado. And again, this is just kind of introduction to us. So some of the objectives that we have for tonight, first is just talking about having a specialty practice without some of the extra barriers that we have. We're going to go into the medical applications of the ALTIUS, including the TBI and migraines, how to get started with the ALTIUS in your practice. Coreena is going to take over at this point, go into some billing and coding specific. We also do mainly workers' compensation. So we're going to talk about that. She's going to speak on that a little bit as well, and how we actually get compensated through workers' comp and our DME agreement. Last, we're going to go through, and this I think is the most important part, we're going to go through some case studies, some patients that I've actually worked with the ALTIUS to kind of give you a little bit of background about what happens when they actually try these contacts. So again, we're talking about the medical applications of ALTIUS. ALTIUS was originally made more for sports vision. For me, it has worked wonderfully well in my practice for my brain injury patients, and it has made such a huge difference. It's probably been one of the biggest things for my patients. As far as a new development to help them in their continued care. So the main things I focus on, I do a lot of traumatic brain injury, a ton of post-concussional syndrome, few migraines, but with that, all of my patients have migraines. It's just not the primary reason. So it's not idiopathic migraines. It's actually due to the injury. And then just different ocular conditions with light sensitivity that occur. So I'm going to kind of go through this pretty quick because you guys can take a screenshot if you want to. But basically the prevalence of TBIs is pretty large. So I am unfortunately not worried about losing my patient base because people are getting injured all the time on a daily basis. The other thing that most of my patients, or actually pretty much all of my patients have, is post-concussional syndrome. Almost all of them also have the light sensitivity to go along with that, and their light sensitivity is very severe for the most part. That's by far the most common symptom that I hear reported from my patients is the light sensitivity. And some of this you might not think of, because I know we all think that it would be, being outside in the bright sunlight or being under fluorescent lights. And I know we think about that, but even some of the things that they struggle with is if they're driving down the road in a vehicle and there's trees on the side and they're going through shade and then light and then shade and then light, or having a ceiling fan moving, or their windshield wipers moving. Things like that can really interfere with their vision depending on what lighting condition that they're in. And then trying to manage that is a big key for them because they cannot control a lot of their environments. When I see patients, most of them have basically lived in a cave, they felt like since the injury. So they're in a very dark room, they have all their lights off, they have their shades drawn. If they're outside, they have sunglasses, they have a hat. A lot of my patients have, kind of that look where they have their sunglasses, they have their hat, they usually have a hoodie on over it. They're trying to keep any sunlight out possible. So the other part of this application that I feel like if you're not focusing on the brain injury part, is going to be huge for other doctors, which would be the migraines. These contacts, like I said, my patients have migraines most every day because of the injury, but everybody has patients in their practices that have migraines. So that is a great place, I feel like, to start, because it's a place that with patients you already have, you can already take the patients that suffer from this. You can let them try it. You for yourself as the doctor, you can get some feedback and know that yes, it does work and it does help. Again, photophobia is a big symptom with normal migraines. Most patients are having troubles with exposure to light, especially blue light. They're either triggering or worsening the symptoms that they already have. And most patients with that will tell you that yes, the lights are a pretty big trigger for them. So when we have patients with glare sensitivity, like I said, it's the most common complaint, the light sensitivity that I have. And this can include a couple of different things. It can be just abnormal sensitivity to light. They can have a lot of ocular discomfort and pain depending on the light situation that they're in. Their headaches most of the time will get quite a bit worse depending on their lighting. It's a lot worse with computers, especially, also with fluorescent lights and headlights at night. A lot of them have just kind of a general aversion to light. They really try to avoid it almost at all costs. Most of my patients can barely even sit in a normal lighted room to be with their patients. So if you think about your migraine patients when they're in an active migraine, that's for me what my patients have almost every day. But again, every clinic is going to have some patients that have those migraines that are already suffering from this. You're also going to have some that already have light sensitivity for other reasons. And it can be even from a concussion that they had decades ago, and it can still be causing this light sensitivity issue. Some of the treatments that we have, we always do transitions. We typically do extra active. You can do the FL41 lenses, the anti-reflective coating, blue light blocker, some sunglasses, but of course we know with those, the tricky part is there's always light that's still getting around. So the patients are still going to be exposed to light unless they're wearing, some type of goggles that is fitting directly on, really tight to their orbits. It's not going to matter. And then now we have a new opportunity, which is with the ALTIUS. And I will say, as soon as this lens came out, I jumped on it as fast as I possibly could to start utilizing this for my patients. So if we're going into talking about starting this in your own clinic, like I said, every practice is already going to have patients who are migraine sufferers. So that's a good place to start because you already have those patients. You don't have to go out and spend money to get new patients. You're not doing anything like that. The other thing is I don't have any extra equipment that I use for my brain injury patients. We do regular exam. I do extra sensory motor stuff, things like that. But I didn't have to buy an extra big piece of expensive equipment to get started with this specialty in my practice. So it made it much easier for me to actually focus on that. The other thing that I feel like as doctors, we tend to do a lot is when we have patients come in and in their medical history, they might mark that they have migraines and that they have, photophobia, light sensitivity, however it is on your medical history. But a lot of times I feel like we don't really address those situations because we don't have a ton of options to help patients. And as doctors, I don't feel like we really like to bring things to the forefront if it's not something that we can fix. So this is something that I feel like even just on your medical history, being a little more diligent as far as paying attention to patients who do mark that they are having some of these problems. It might warrant just giving them, an extra questionnaire about light sensitivity, or talking to them a little bit more about their migraines. How often are they happening? How sensitive to light are when it does happen? So there's definitely different things as far as with patients you already have, that would be an easy thing to implement in office without any extra cost, pretty much. The other thing, if you're thinking about getting into more, especially like the concussion or the TBI stuff, you want to start definitely communicating with other providers. So my current practice is basically, it's 100% referral based from other doctors, most of whom do concussion treatments. So for me, it's kind of nice because anymore I don't have to spend money on marketing. I don't have to spend money on advertising. I don't have to do any of that. Because again, unfortunately, my patient base is still going to be there, because there's still going to be patients getting injured. And those doctors that I've worked with, we have a rapport now. So we're kind of part of this group that takes care of these patients. Most urban areas, you are going to have, especially surrounding the bigger university hospitals and things, you are going to have some TBI teams. So they're going to be different specialists on this team, where they try to really cover all the bases that these patients might need. But almost none of them have optometrists included. And I would venture to guess most do not have ophthalmologists either. So this is an area that we can really help with, because a lot of other doctors they're not great about finding the vision issues. And if they find them, they're not great about knowing where to send the patient. So, and on that end, I feel like we need to, as optometrists, do a better job making sure that we get the word out that we can help treat some of these symptoms that the patients are having. Some of the specific doctors in your area that you would want to reach out and talk to, neuro is a big one. Orthopedics is a big one, because they see a lot of traumatic concussion patients, because a lot of times they have had other bodily injuries when they were injured. A ton of therapists, PT, OT, speech, even they're seeing these patients pretty consistently. You might have specific concussion specialists in your area. And also I've worked with some pain management specialists, which, they're focusing more like with the migraines and things like that. But just to give you a list of some possibilities of doctors to reach out in your area to speak with, and that's going to help get you started. Once you start getting some patients under your belt, it's going to make a huge difference. So the other thing that I would say is, do not think of ALTIUS contacts only being for contact lens wearers. I would say over half. I would say probably me and Coreena agree, at least over half of our patients who wear ALTIUS contacts almost every day had never worn contacts prior to us seeing them. Some of them have, which makes life a little easier. You're not doing INRs and stuff, but most of them have never worn contacts. This is whether they didn't need correction or it just not something they thought they needed. But when it comes to patients who are having consistent migraines, who have had a TBI, they're having the ongoing light sensitivity, those patients will learn how to put the contacts in, because if it is going to help their symptoms, they will do whatever they need to. For us, we actually keep, which we have a fit set of ALTIUS. We also, even before that, even before we got our fit set, we were keeping demos on hand. So one of the things that you could do, even just in your office, keep some Plano lenses in stock. You can give, just a single pair to the patient so they can actually see, how things look. The nice thing for us with my brain injury patients is they get an immediate response to these contacts, because it's when they put it in, they get immediate relief from some of that light sensitivity. For the contacts, the gray green is going to be that's what I use almost exclusively. That for me has worked much better for my TBI post-concussion patients. The amber color works really good for patients who are going to be ongoing doing sports, anything that they're tracking a ball, things like that. So a little bit different as far as how they're used, but both phenomenal contact lenses. Like I said, the patients, it's nice because they do get immediate results. Like as soon as they put the contact in, they can immediately tell that things just overall just kind of decrease as far as the oversensitivity to everything. So a lot of my patients, they just feel not only the light sensitivity is better, but they just feel more comfortable with the contacts in. The other thing is for my patients, almost nothing, no treatment for a TBI or a post-concussion patient gives them immediate relief. And literally, I cannot think of anything that they get from any doctor that gives them immediate relief. So this is one of the very few things that they can actually get immediate relief for. And you don't have to just say, well, we have to watch and we have to wait and we have to see how it goes. This is something that they know right away, which is fantastic. For my patient base, they tend to wear the ALTIUS contacts almost every day. Most of them will be in the contacts for at least a year, if not longer, because of the symptoms that they've been having. So what our office, what we have chosen to do, we actually give out a 10-day supply of the contacts. So yes, we do. We eat the cost of that. But again, for my patients, we're getting minimum of a 6-month supply, if not a full year supply. So for what we do, that is financially, that's still conducive to what our patient base is. When I was in my private practice, that's not necessarily what I would have done. I probably would have done a pair or two. But again, it's a little bit different if you have patients who are going to be wearing them every day, or if you're going to have patients who are wearing them when they have active migraines or, certain times that they need them. So it might be a little different in your own practice. It might look a little bit different. But either way, the patients can tell right away. This is not something that it takes a long time for them to determine if it helps or not. Most of the time, by the time our first follow-up, patients are like, yep, it's amazing. I love them. I need to get some. So that's one of those things that it doesn't take months to get an idea of if they're going to work or not. It's going to be one of those things that they're going to know pretty quickly. And most of them can see really big benefits right off the get-go, which is fantastic. So now that we've kind of talked a little bit about how to get this started in your practice and, kind of some different things on how to go about it with patients, I'm going to let Coreena get into some billing and coding stuff, because that's some of the specifics. And it's hard because I know it's that we don't like to, as optometrists as a whole, we don't usually like to talk about finances and money a whole lot, but it still comes down to if we can't make money, we can't stay in business and continue to take care of our patients. So for me, the billing and coding is a big part of it, because not only am I helping patients, but the billing and coding is helping take care of my business so I can keep doing what I'm doing. And like I said, Coreena has done all of my billing for me. She is fantastic at getting us paid, which can be a struggle when it's work comp, but she has done a very good job. So I'm going to pass this over to her real quick. And then just so you guys know, after that, I'm going to come back on and we're going to go through those case studies. Okay. All right. So I'm going to pass it over to Coreena.
Hi, everyone. My name is Coreena. As Dr. Webster said, I have been specializing in workers' compensation billing for the last 4 years now. And that was in her private practice and then our new neurooptometry practice as well. So some of the objectives I'm wanting to go over today with you guys is going to be the procedure codes that we use and some of the useful diagnostic codes that, is necessary for billing, some of the workers' compensation specific billing, and then we're also going to go into our DME fee agreement that we have implemented. So for the procedure codes, we use the following codes and descriptions. So the V2524 is for the contact lens, which has the photochromic additive. And then the V2526 is also for the contact lenses with the blue-violet filter. So we refer to these as our daily tinted contact lenses, just to make it more streamlined for our billing, handling with the adjusters through our work comp claims. Another one we use is the 92310, which is for the medically necessary fit. We only bill this code for workers' compensation if the patient has never worn the contact lenses previously and required an INR. Since ALTIUS is a specialty lens, we code it as the medically necessary fit just to ensure proper payment. So for the diagnostic codes, the first one we use is the F07.81, which is for the post-concussional syndrome. Most patients we assess have suffered from a TBI or a concussion. with workers' compensation specifically, this code must be listed first to show that all of the, DME that Dr. Webster is prescribing is due to the work-related injury. Another code we use is the H5371, which is for the glare sensitivity. We use this one to identify the light sensitivity in our patients because unfortunately there is no specific code for photophobia at this time. And the light sensitivity and glare sensitivity is one of the most common symptoms for our concussion patients, as Dr. Webster had previously mentioned. And this code must be used in conjunction with any prescription for tinted contacts, just to ensure that the adjuster understands why we are billing for this and what the contact is used for. So with workers' compensation, which is our main patient base with our company, as Dr. Webster had stated, it's all referral based. We do not see any of our workers' compensation patients unless they have been previously referred to us by another doctor. With these cases, we do send out a prepayment invoice for our services to ensure that we are paid. That covers the whole entire exam with Dr. Webster with the refraction. And then we also do fields testing and we take pictures of their eyes, make sure everything's nice and healthy. So that prepayment invoice covers everything that we would do in the initial appointment. So with workers' compensation, we cannot order any DME or durable medical equipment until we receive an approval or denial from the adjuster. That's just the way workers' compensation goes. So if Dr. Webster does prescribe glasses or the tinted ALTIUS contacts for our patients, we cannot order them until the adjuster says that we can proceed with that. Also with workers' compensation, there are state fee schedules. Now with this, every state is different. I know right now Missouri does not have a state fee schedule, but Illinois does, which is another state that we get a lot of our patients from, just because it's right on that border there. So you'd have to, if you do want to implement this into your practice, you would need to research your state's guidelines regarding this just to be fully educated before moving forward. With the state fee schedules, there are reductions that every company makes typically whenever you bill for a service or DME, which is why you would need to look at each state fee schedule. So due to the reductions, we have implemented a DME fee agreement with all of our workers' compensation claims. So when is the DME fee agreement used? So this is initially sent to the adjuster with the prepayment invoice. This just ensures that the adjuster is aware of any potential upcoming charges, just so there are no surprises once the patient is seen by Dr. Webster. I mean, typically we prescribe some prism glasses or the ALTIUS tinted contacts or both at the same time. So we want to make sure that the adjuster is aware of anything, that may come up in the future, just so they're not surprised. And then the adjuster must sign this agreement before we order anything for the patient, which helps avoid unwanted reductions and also expedites the billing process. We found that with adjusters signing this agreement, we're getting paid faster, we're getting paid correctly, and it just streamlines the whole entire process. So why implement a separate agreement for DME? So insurance companies typically send invoices straight to their bill review department, which then makes reductions based on either usual and customary rates or their state fee schedules, which is why you would need to, of course, look at your individual state's guidelines. The usual and customary rates go off of your geographical region and just what other offices in the area are charging for those same services.
Can I add something?
Yeah, go ahead.
I would say to keep in mind that their usual and customary rates is for primary care optometry. So for us doing specialty care, the usual and customary rates are not going to cut it for what we do. We had tried that, and that's one of the reasons we started implementing the DME agreement, is because we were not getting reimbursed at the level that we needed to either cover our cost or to make sure that we would be able to continue having our business open. So that's why we actually got into that. But just so you know, that's kind of how that part worked.
Yeah, exactly. So we found it better. Our process is way better now that we've implemented this. We don't usually have any pushback with it. So it's definitely made our practice more efficient on the billing side. And then even though ALTIUS is a specialty lens, there is currently no procedure code that accurately describes it. So submitting this through a bill review department would result in minimal reimbursement. So like Dr. Webster said, they're going off of a regular practice, not, the specialty lens part of it, because it is a special lens, but there's just no code for it. So they would run it through their bill review department as a normal, just daily clear contact lens. And that is, of course, not at all what this contact is. So what is included in this agreement of ours? So in ours, we have an opening paragraph that states the purpose of the agreement. You basically just want to introduce your practice and explain why the agreement is in place, and then just to hopefully get everyone on the same page about, prices moving forward. And with that, a list of all of our frequently used billing codes and fees are attached to it. We include this just so everyone knows what to expect if a patient is prescribed any of these, the specialty contacts, the prism glasses, any visual therapy equipment that might be necessary, and the blue light blocker,
any other glasses stuff.
Yeah, any coating that we put on the glasses, the frames and themselves, the lenses, the specialty contacts, and the supply for each, each contact we use is listed out on there, just so the adjuster is completely aware of what is happening and what we are charging. And the most important section states that by signing the agreement, the adjuster or the billing representative for the claim agrees to reimburse a certain percentage of any future DME that the doctor may prescribe, if it's approved to order, of course. So I've included here what our DME fee agreement specifically states, which just says the undersigned hereby acknowledges that the entirety of this document has been reviewed and agrees that any future DME prescribed by the doctor will be paid accordingly if approved for ordering. So we mainly want to lay this out like it's a contract. That way they know that by signing it, they are providing approval for the equipment that Dr. Webster has prescribed or the contacts, and they are agreeing to pay us a certain amount.
And our agreement, so we usually charge at least 80% of all of our normal fees. When we had gone through straight billing and it went to billing review, we would get anywhere from 30 to 40% maybe of our total billed. So the amount that we have been able to get reimbursed for that has been huge. We do have some times where they sign the agreement and they still send it to bill review. So then we just have to remind them, nope, you've already signed this agreement with us. You have already made this contract. This amount is not going to be sufficient. You need to, get it up to the point where it needs to be. So after we implemented the DME fee agreement, things have gone much, much better for that. I will say too, one thing to keep in mind, if you are, sometimes you have to pay attention if you're part of medical insurance, because you still, if you take a certain medical insurance, you still might be bound by their fee schedule. For what we do right now, after I got out of my private practice, I do not take any insurance. I'm not listed on any insurance anymore. So for me, I don't have to worry about that part because I'm not in network. But in my primary care office, that was something I had to keep in mind and keep track of when I was moving forward doing the brain injury patients, because it can be different if you are in network for certain insurance companies. So just kind of something to keep in mind.
So with the DME fee agreement, ever since we implemented it, beforehand, we were getting payments of, like Dr. Webster said, 30 to 40%, which would barely cover our cost. And of course, as a small business, you want to make money, of course. I know we don't like to talk about it too much, but we do want to make money. So with our DME fee agreement, that definitely helps that process. That way we are getting reimbursed more than what we're paying into the patient.
Yeah. And that's also one of the ways we've been able to give patients a 10-day supply. And I feel like we're still, financially, we're still good to do that. Again, because we already have the DME agreement in place. And once we order that 6-month or year supply, we know we're going to get 80% minimum of those fees, if not 100%. So, so that has helped too.
So as we have already kind of touched on, since implementing this agreement into our workers' compensation billing routine, we have experienced a more efficient approval and denial process. Since the adjusters are signing this agreement, they are not having to really talk too much about like the billing process and everything. So they're able to approve the contacts and the glasses much quicker, which is great all around because then our patients get them quicker and their symptoms are alleviated much faster than typical, than waiting for it. We're getting more accurate payment amounts, as Dr. Webster touched on. We do still get a few checks that are below the agreed upon amount in the agreement. But if that does happen, since there is an agreement in place, all I typically have to do is just email the adjuster stating, you signed this agreement, we need this additional amount to be compliant with that agreement. And they're very quick to fix the issue. And we're just getting faster reimbursement rates since it's not having to go through the bill review department, which can take about 30 days to process, and then an additional 30 days for them to actually issue the check. With this agreement, they already know what amount is owed, which makes it very quick for them to just enter it into the system, cut that check, send it out to us, and we're getting paid within 30 days of sending that invoice over, and it's the correct amount. So that is all I have to talk about right now, but if you have any questions, we will be answering those at the end of the webinar.
So I'm going to go into a little bit more with the actual patient care here. So some of the impact that this can have on your practice, like I said, not only financial, because that is a big advantage, but you're also giving very individualized care for your patients. You are addressing a need that has probably never been addressed for them before in their lives, pretty much. Not to this extent that people might have talked to them about it, but not really treated it because we didn't have great treatments for it, to be completely honest. So it's one of those things that it can really set you apart. And I will tell you, a lot of these patients, whether they be migraines, patients who've had past concussions, or somebody who just has overall pretty bad light sensitivity, these patients definitely do talk to each other. They talk to their families, they talk to their friends. And that's also where a lot of the referrals will start coming in, because you'll get patients talking to each other. We actually get asked quite a bit if we see regular patients, just non-brain injury patients as well, which we don't. But we do get asked that quite a bit because patients have heard about this. Even if they don't need the contacts, they've heard about it from people who are using the contacts. So you get that good word of mouth out. The other thing is, for my patients and some of your patients, if you choose to do this, you're going to change lives. So I've had some patients who could not get back to work until they wore the contacts. I've had patients sit in my chair and cry because they didn't think they'd ever be able to drive at night or drive at all again. And then even when it was sunny, you can make a huge impact on these patients' day-to-day lives. And that is one of the most rewarding things for optometry that we can do. Okay, so I'm going to get into some of the case studies. Case number one, this is Cameron S. She was a 22-year-old white female. I saw her first on April 17th of last year. She had fallen on the ice in the parking lot where she worked at the end of December of 22. So it was about 4 months before I saw her, and that's not out of the norm. I think the soonest I've seen somebody after a brain injury is probably 1 or 2 months. I've seen them, typically 3 or 4 is a pretty good average, but I've seen some, and I have another case study that it's been years afterwards. So that's not out of the norm. She went to the ER that night. She was diagnosed with a concussion. When I saw her, she had been currently wearing a NeuroLens, which helped with her vision, but she still struggled up close, and she still had some of the other effects of the light sensitivity. She was having some headaches. It was every day. She said she felt like someone was just squeezing her eyeballs. They always started on the one side. She was seeing a ton of flashes and floaters, a lot of distortion. She could not be on the computer very long. She was getting double vision a lot. She was in college for accounting, so she was also trying to do that at the same time she was working. So she was really struggling when we first saw her. So the NeuroLens that she came in with, you can see her prescription there at the bottom and her entering acuities. And then for her, this was the updated script I found. So not a huge prescription change. And I will say that most of my patients are 20/20, which is good and bad. It's great that they're 20/20. It's hard because they still functionally struggle a lot, but the 20/20 is one of the main objective measurements that I have. So I have to go through and really talk about some of the other things that I'm doing. So for her, she did have a little bit of accommodative insufficiency, not a ton, but a little bit. Her Virgins ranges showed that she really needed some basin for up close. She was convergence insufficient like crazy. Ocular health was fine. There was no PVDs, no nothing, no retinal detachment, nothing else in the inside of the eye. Everything was totally fine. Also, her visual fields, we always do threshold on everybody. Visual fields were great. So after her initial eval, what we decided to do, I did a separate prescription up close for her computer work with the Basin Prism. We did anti-glare and blue light blocker on there because, again, she's very light sensitive. And then for her, we went ahead and did an INR that day for the lenses. We did Plano. She wears them underneath her Prism glasses. And we wanted her to start wearing them full time as soon as she could. So we spoke to her after we fit her. We spoke to her over the phone about a week later. She had started driving, which she had not been doing for the past 4 months. She was able to start driving. She said her anxiety was decreased. The comfort was good. We did go ahead and order her a year's supply. So with her, she was finalized with the ALTIUS and the Prism. We ended up doing sunglasses and computer glasses for her as well. I finally did diagnose her with just visual snow. The floaters that she was having have still never gone away. I think I just saw her a month ago. So for her, it really helped with just kind of everything overall that was going on. So all of my patients get really bad oversensitivity, overstimulation. And it happens everywhere they go, whether they're sitting in a restaurant, they'll tell me I can't sit in a restaurant because I can't focus on anything because they're trying to focus on everything. And with her specifically, with her visual snow, that was one of the main reasons that she did not feel like she could drive at all. After she tried the contacts and I spoke to her the first time, she felt like it decreased her visual snow by about 85%. That was what she had told me. And she has been able to continue driving ever since. So that part has been fantastic for her. Because if you can imagine being a 22-year-old trying to go to college, trying to work, and you can't drive, not the easiest thing in the world for her. So she was very, very happy with this. So I've talked to her and she gave me a couple of, I talked to her about the contacts. So these are a couple of things she had to say about the ALTIUS specifically. So before using these contacts, I could only drive maybe 10 miles a day in her car on a sunny day. After getting them, she can tolerate driving much further distance. She said during the sunny days, they are a life changer, but even on cloudy days, I use them because my light sensitivity is so severe. So she is one who's wearing them every day. She still, to this day, like I said, I think I saw her a month ago, maybe a month ago. If she does not have the contacts in, it's still the same. The visual snow is really bad. She can't drive. She has to have them to function. So that was Miss Cameron. Next, I am going to go into Sydney. Sydney is a 25-year-old white female. Hers has been a long-standing one. She'd been hit in the temple with a softball back in 2016. She did do some PT for her eyes after the injury, she said, but she'd kind of always still felt like she had a lazy eye on the left side since then. She was getting headaches every day. She was getting double vision that was worse at night. I think she did tell us she'd been in several, I have that down there. She'd been in several motor vehicle accidents, and she said she just thought she was a bad driver. She felt like she didn't realize that there was really something going on with her eyes. She is one of several that have told me that she couldn't drive with her windshield wipers on because she can't, that overstimulation, she can't focus on anything when the windshield wipers are moving in front of her. And that's actually not an uncommon complaint for me to hear. I hear that quite often. She had actually worn contacts in the past, but she was not wearing any contacts or glasses anymore because she didn't feel like they were helping at all. So when she came in, her initial evaluation, this was pretty recent, so it was back in November. She was not currently wearing any correction. She was 20/30 and 20/40 without anything. You can see her refraction there, not much. She was again 20/20. For her, she had several things going on. She was very accommodative insufficient. She needed a +2 add for anything up close. but she was also convergence excess. So she could not accommodate, but her eyes were really trying to do the work for her. Her visual fields were also completely fine. Ocular health, no issues there either. So for her, what we ended up doing, we did some progressives with base out prism to help relieve some of her convergence excess. The progressives, obviously, to help the accommodative insufficiency. We did the AR and the blue light blocker, which I do for almost all of my patients when they have prism. And then that day we had her start wearing the ALTIUS contacts. When I spoke to her the following week and I saw her, she said that her headaches at work had been less than they had been in years. She was able to function under fluorescent lights. She said the computer was much better. She ended up continuing to wear the contacts with the prism glasses as well. And a couple of things she had to say about the contacts. She said 11 out of 10 for comfort, performance, and effectiveness. Highly recommended them to anybody, but especially people with head injuries, because again, she didn't even realize she was having that some of the problems she was having could actually be fixed. She thought this was just going to be the rest of her life like this. And she did speak a lot about how it just changed the quality of her day-to-day life. Because she works in a clinic and she's under fluorescent lights all day long. She also said they were way better than wearing sunglasses 24/7, which is what she had been doing prior to. All right. And I think we're good on time. Rachel, are we good on time? I want to go through one more case study if we can.
We're good on time.
Okay, good.
You know, we
Good
haven't
deal.
really had very many questions. I think you guys have been so thorough. So feel free to take as much time as you need. This is wonderful. Thank you.
All right. So next we have Mario A. Mario is a 43-year-old Black male. I've seen him for the last 7 years or 6 years, I guess. So no, it's 7. He was injured and this was a work injury. So it was work comp. It was back in August of 2016. He was punched repeatedly in the side of the head at work. He had been diagnosed with a concussion at that time. His light sensitivity was really, really difficult for him. And of course he worked, I believe he worked either in the prison, I believe is where he was. I think he's a police officer. So corrections officer, that's what it is. He had worked in the prison. So he was under bright fluorescent lights all day long. He had done some PT and OT. He had been wearing glasses. He said they only helped a little. He was really wearing his sunglasses all the time. So when I first saw him, he wasn't wearing his actual prescription because he was just wearing his plain old sunglasses, but you can see his prescription there. He was only 20/80 when I first saw him. We had a prescription change. We did get him to 20/20, but a couple of things he had going on. He was also very convergence excess with accommodative insufficiency. So and at distance, his trouble was he was very exophoric at distance, convergence excess at near. His eyes were kind of a mess. They weren't wanting to do at all what they were supposed to do. His visual fields were good, which I will say all 3 of these case studies of visual fields have been good. That is not typically the case for my patients always. A lot of times they'll have scattered defects, nothing specific. It doesn't respect midlines. It's nothing like that. It's just kind of random scattered defects. So just so you guys know that for a background. Ocular health was fine, which again is pretty typical for my patients. Their eyeballs are healthy. They're just not functioning correctly. So for him, what we did distance only glasses with some base and prism. We did ophthalmic and suns because he had to have those. And at this time, again, this was back in 2017. So the ALTIUS were not available to me at this time. We also did a near vision script for him with some base out prism to help with his convergence excess and his accommodative insufficiency. And then finally, again, we added the anti-glare and the blue light blocker on there. So when I saw him this past summer, because he had gotten to where he was pretty stable and we got him back to just kind of annual exams. So when he came in for his annual exam this year, I was kind of excited because I had something new I could talk to him about. So we gave him the contacts. He did very well with them. He did report that his migraines had decreased quite a bit, not gone, but they had decreased significantly. He had an increase in activities that he was able to do. He was able to work easier. We did a year supply and sent that to him. I expect him to be somebody that uses those contacts for quite a while, actually. Some of the things that he had to say about it, for him, he had the issue with the really bright piercing light. And he would get the sharp pains with his migraines when he didn't have the contacts in. So after that, completely stopped that issue. And after wearing the contacts, I should say, he said it was kind of a game changer for light sensitive people, and it was the best thing to ever happen to him. So, which might sound like he's being, a little bit overly dramatic, but again, for a lot of these patients, it allows them to live their life. And I talk to patients, I'm like, this will allow you to just sit at your kitchen table and eat with your family again without being miserable. Or sit down and watch, you might not be watching the TV show, but sit down with them in the living room when they're watching a TV show. Things like that you don't really think of, that some of these patients are not able to do anymore because of either the migraines or the injury or the light sensitivity that they're having. So it really does affect their just day-to-day life, and not just at work, it's even being home with their family. So that's one of the things that really for me made a big difference and wanted me to continue down this road with these patients, is because you can make such a big difference in their lives. So we are on to some questions.
Great. And actually, can you go to the next slide? Because that might answer some questions and people can kind of look at that while we're talking.
Absolutely.
The next slide is our prices, right?
There we go.
There we go. Okay, I'll just leave that up as we go.
Okay.
That was one of the most questions. So the first question, and I'm really glad you asked us, and we can kind of clarify a little bit, and I can kind of co-answer this with you, Dr. Webster, but it's how does the blue light benefit as compared to tinted lenses? So first I wanted to clarify that the ALTIUS tinted contact lenses come in amber and gray green. Both designs block 100% of UV light and over 99% of blue light. And then we're manipulating through light architecture, the light that we're letting in and the light that we're not. So the amber is going to allow a little bit more in the yellows and orange hues, where the gray green is going to be more, like a G15. And it is going to have, so 50% light transmission blockage for the amber and 62% for the gray green. So Dr. Webster, do you want to speak about your experience in using, the two different tints and which one you fit and when, and a little bit more about why that blue blocking helps your patients?
Yeah. So, and I think I'm not positive, but I think they're maybe asking the comparison to blue light in the glasses. Is that right? I'm not sure if that's what they're asking specifically. But one of the things the ALTIUS, both either the amber or the green, all block way more of the blue light than any other lens that you can get. And the blue light is the biggest aggravator for my patients. So the nice thing about the contacts is you're going to get edge to edge. They're not going to have any of that blue light filtering in around their glasses. For my patients, initially we started with giving them some of the orange amber and some of the gray green lenses. But for my patients who are not, they're not sports people necessarily, for them just to get back to work and overall, get their life feeling back to normal, we had almost every patient wanted the gray green for that in particular. So the gray green is kind of what we go with most for our patients that have the neuro issues. I do believe the amber would be better if they were going to continue, if they're doing sports, if they're, and especially if that's where their injury came from. It might be good to have the orange amber to use for that. But for me, we do most all gray green is the most positive thing that we do. And then, like I said, we usually do it, even though the patient doesn't necessarily need a blue light blocker on their glasses over top of that. There might be times where they either can't wear the ALTIUS or they don't have it. Or if it's at nighttime, they don't feel comfortable wearing the ALTIUS. So I still want them to have that blue blocker on the glasses. So I do that as well.
Great. Thank you, Dr. Webster. And if you have any follow-up questions, feel free to just put a follow-up. So the next question is, do you ever recommend FL41 with the ALTIUS lenses?
So I don't do a ton of the FL41, to be completely honest. A lot of times, because we utilize the ALTIUS so much, we'll use the ALTIUS, and then if they need to, we'll either do a pair of just kind of dark gray tinted sunglasses, or we might use a clip or something on their glasses as well. The other thing that's a little tricky for me, since I do work with work comp quite a bit, it's very hard to get them to cover any type of sunglass. They're actually much better about covering tinted contacts than they are about sunglasses. So for a lot of my patients, we try to do the contacts with the clear ophthalmic glasses over top of it. I usually have to jump through some hoops and prove that they need the sunglasses for work comp to actually cover those. And to me, the FL41 kind of fall in that category. But I also don't feel like a patient, if they have the ALTIUS, they don't necessarily need the FL41 either. A lot of times they can do pretty good with just a regular pair of sunglasses, or, you know, we do transitions in their glasses too. So I will say that for that, I do not use the FL41 very much.
Great, awesome, thank you. Next question, how does a private practice that takes insurance mitigate the payment conundrum as compared to you who doesn't take insurance? What are the billing caveats?
Yep. So I actually, like I said, when I was at my private practice, we did take we took all the major insurances. I will say the difference is obviously the reimbursements are going to be lower, but they're also going to be closer to what you would get, you know, with a vision plan or something like that. But the other thing, as far as there was a couple of insurances that when I was doing work comp through that insurance company, their billing was so decreased that it was not worth it for me to keep their insurance. So it actually kind of prompted me to get out of network with a couple of insurances that were not really benefiting me anyways. And I think sometimes as the practice, you know, in a practice, you just kind of get on every insurance you can to get people in the seats. But it's not always monetarily worth it to do it that way. So for me, I really had to start looking through and seeing, okay, which insurance is worth it, which isn't. So I did a lot of research on that on my end for my private practice. And then when we chose to go out and separate and just do brain injury stuff, that's when we chose to do just basically not be in network with any insurances. So I didn't even have to mess with that. Some of the billing caveats, like I said, the specific codes and stuff, you want to make sure that you're giving the medical codes. You want to make sure that there's some type of glare sensitivity or ocular discomfort, something on there to show that you are treating the patient, it's not cosmetic, and it's not something that it's just that they want. You are treating a problem that they have. I do not believe ALTIUS is covered by medical insurance. It would be fantastic if it was, but I don't know that insurance covers any medical contacts really, for the most part, not a ton, at least not in my practice could I get that done. But some of the caveats are really trying to figure out the specific codes that you need to use to try to get that reimbursement. So, because otherwise they'll look at it as, well, you just gave them contacts. That's all you did. No, I treated a whole bunch of their symptoms, and I did this contact did a whole bunch of other things. So you need to make sure your diag codes correlate to that. So it shows that, yes, you are treating medically these things with the patient. And we try to show that. So even down the road, if it does start being covered by medical insurance, we have a history of, yep, this is what we've always done. This is what has worked. So that's kind of some of the caveats, but it comes down to honestly reading some of those really lovely contracts that you have with insurance companies and figuring out which ones are worth it to keep and which ones are not.
Awesome, thank you. The next question is about what power range parameters are available, and I can take this one. So our lenses come in plano to -6, so it goes plano, -50, and then in quarter steps up to -6. And again, they're available in the 2 tints. They are sold in 10 packs, as you can see. So we did not set up a trial system. We have, as you can see here, we've set up a way that you can earn free demos as you purchase, because we did find that demoing a pair of lenses in the office, or even if they want to take a pair to try for a specific activity, it's probably the most that you would want to demo. But for the most part, you can sell those 10 packs in smaller quantities to give them the availability to try the product as needed. So I hope that answered your question. The next question is, how does ALTIUS help in albinism?
For me, I don't know, but I would be very curious to know how that actually works. I would think it would make a huge difference for them. The only other thing I could think that might help a little bit would be, you know, one of the contacts that has opaque iris on it, basically. But those, as far as I know, only come in a yearly, and they're not obviously the healthiest thing that we want for patients' eyes. But I would be very curious. I really don't know. And I think with the ALTIUS, there are so many possibilities of applications. Albinism would be one of them, partial albinism. So I really don't know, but I do think the patient would probably be overall just much more comfortable, again, just day to day. But I don't have any albinos, so I'm really not sure about that, but I would be very curious to see how that would help. I would also be curious to see if they have any nystagmus or anything, if that would help, not make it go away, but help stabilize that at all. And I really don't know for sure, to be completely honest. It's one of those things that hopefully somebody will start maybe looking into and figure out.
And I can actually speak into that a little bit. And as you said, you know, the medical applications for this product, every day I'm getting emails from doctors who are using this lens in different ways. So I do have a doctor that's fitted on 2 nystagmus patients, and I just have yet to be able to follow up and find out if albinism could have been an underlying cause, in which obviously that would be a great case study opportunity. But in regards to the light sensitivity element and the light blocking, I do feel that this lens would be a great option for the patient for the light sensitivity element. And as I said, I know at least there's been 2 patients fit who ended up purchasing product because they did say that it helped with their nystagmus. Next question is, do you think TRICARE would cover these lenses?
My first response would be probably not, or no, I shouldn't say that. Not anymore. They wouldn't cover this at any higher cost that they would probably any other regular lens. And I don't know for sure, because like I said, sometimes with the medical stuff, it's hard to get them, you know, to cover things like this, even though should it be? Yes, in my opinion, it absolutely should be. And that's one of the things where you'd probably have to do a little bit on your own, trying to figure out with the insurance companies, or at least just try to submit it and see what happens. But my knee-jerk reaction would be no, but I don't know that for sure. The one thing I would say is a lot of patients, especially the patients that I have, honestly would not really care if their insurance covered it or not, because it makes such a difference in their life. So that would be my other thing. I would say don't shy away from letting a patient try it, even if their insurance doesn't cover it, because it still might be worth it to them to even get, you know, a 30 or a 90 pack or something, maybe not a whole year. But even if their insurance doesn't cover it, I wouldn't count that patient out, because it still might be worthwhile for them just in their day-to-day life to have them.
So the next question is, no concern about decreasing sight at night in low vision driving. So I guess, is there a concern about the decreased sight at night in low vision driving?
So I would say, I mean, yes, there is definitely a concern. I don't have a ton of patients who use them driving at night, which is also why they have, you know, the blue light blocking glasses. But I will say I do have some patients who actually do wear them driving at night. One of them that I can think of specifically is a police officer in St. Louis, Missouri. She does not feel like she can do her job at night without them, because she, you know, of course, the flashing lights and the oncoming headlights. So I do think this is something that is very, very per patient, and it has to be between the doctor and the patient to really discuss that. I feel like it has to be a patient that you trust to make that decision, whether they are comfortable, you know, to do that. So it's one of those things that I think that's a difficult question, because yes, or do I have concerns about it? Of course I do, because they are driving at night, and we do have that conversation. And a lot of my patients, like I said, do take them out before they're driving at night. But I would say probably, I mean, she's not the only one. I do have several patients who do wear them driving at night, and they still feel like that still helps improve their vision as far as being able to get down the road safely. So not saying that there's no concern, but for me with my patients, I'm willing to override that concern if it allows them, you know, to get back to their job in a safer manner and do the things they need to do.
And I can actually add to that. One of the benefits of ALTIUS is it increases your adjustment from varying light conditions, so there's faster pupillary responses. So
Yeah.
occupationally, in that example specifically, if she's having to jump out of her car and run into a lighted building and then jump out of the building and go in and out of light and dark and all this stuff, the ALTIUS would actually enhance her vision in that situation. And the official, answer is that would be an off-label use for this product. We have not tested it at night. It wasn't created for night driving. It would be an off-label use, and as Dr. Webster said, it's definitely a discussion that you would want to have that with that patient. But I know, just me personally, my mother battles with insomnia, and she's been using the ALTIUS amber lenses in the evenings only. So she puts them in at sunset and takes them out when she goes to bed at night, and that includes any activities that she might be doing. So again, it's going to be case by case for now as we continue to do study and research.
Well, the other thing I would add to that too is that when they are, a lot of my patients feel like the contacts, like I said, with one of the case studies, their anxiety goes down. They overall feel less stressed out. They're more comfortable. And, a lot of times their heart rate goes down. They're overall feeling more, I don't want to say normal, but they're feeling more how they feel like they should. And that sometimes can be a huge benefit for patients, because my patients they have such high anxiety about driving at night anyways, that sometimes something like that will help decrease their anxiety and keep them calm is going to actually still help them be a better driver at night, even though they have the darker contacts in. So that's kind of, it's an odd offset, but I feel like that's something that needs mentioned as well.
We also have gotten feedback that the amber in particular does reduce headlight glare. So in the reduction of chromatic aberrations, so we're reducing chromatic aberrations by 53% down to about a diopter of disparity between color waves. So that reduction in chromatic aberration reduces visual noise. And that's a big part of why this product works so well for these patients. And, we are actually in the process of starting a clinical study on the reduction of heart rate. So, this has been noticed to such a degree that we're, starting to do a study on it. So it's really exciting stuff. And, again, I hope everyone on this call will continue to keep us informed as they discover new applications and new patients who can benefit. So the next one is comparison between TheraSpecs and ALTIUS.
So we do actually have a patient who wears the TheraSpecs, but she also wears the ALTIUS lenses with them. For most of my patients, the TheraSpecs aren't going to give them enough lighting control that it's going to really change their symptoms drastically. So it's one of those, it's a little hard because I do think it's great in addition to, but for my patients, I don't know that it would be a replacement for ALTIUS, I guess I should say. Yeah, so it just kind of depends, what exactly they're in. And I think a lot of my patients wear the ALTIUS with either their sunglasses or they could wear something over top like that to help. Obviously with the TheraSpecs, I think there's different color options and stuff. But it's one of those that I still think the ALTIUS is going to be, would still be the basis, and then that might be added on top. The other thing I would say, again, with the ALTIUS, it's nice, is that there's no errant light coming in from the sides, from above. Anytime you're wearing any type of glasses, you're still going to get light coming through. And that's usually what bothers my patients the most, is the light typically coming in from the side, like I said, when they are in a car or something like that. So you're still going to have that issue if they don't have the ALTIUS on underneath it.
Awesome. Thank you so much. So the next question is OASIS transitions. Do you have any applications?
So I actually have, I have a couple of patients who have been in OASIS transitions. I'm really bummed that they're discontinuing those. Those are usually if my patients if it's been several years, they've gotten, their light sensitivity has improved some, so they're not maybe needing the ALTIUS all the time anymore. The OASIS transitions is a good one to put them in if they need that. The hard thing is, I believe it's June that those are going away. So for those few patients, I'm going to have to figure out what I'm going to do for them, because it's not going to be an option for me anymore. I will say when Oasis transitions first came out, I did start trying those because they came out before ALTIUS. So I did try those a lot with my brain injury patients as well. But especially the initial few visits, within the first 6 months or year of their injury, a lot of times the transitions was not dark enough for them. They were still struggling with that light sensitivity, even with the contacts in. So for that, the ALTIUS, especially like I said, early on in that injury or early on in the recovery process, the ALTIUS have worked much better than the transitions. And I have actually tried both. And I do use some Oasis Max with the blue light blocker if a patient needs it for nighttime.
All right, next question. Does it help patients with strictly visual snow syndrome?
I don't know that. So because the patients that I've seen that have visual snow have obviously had a concussion or traumatic brain injury as well. My first thought would be yes, that it will actually help with that, because the patients who've had it feel like it literally, they do not see the snow nearly as much as they did before. So even for my patients, even if it doesn't affect their migraines or doesn't affect anything else, the actual visual snow portion, when I talk to them about that, it does reduce that significantly. The hard thing is there's not obviously a ton of patients with visual snow syndrome. So it's hard, to get a big patient base to really know that for sure. But the few that I've had, it did work really well for them. So I am, again, kind of that extra applications of this contacts, but I am really curious to see, again, just exactly like that. Do patients who have visual snow but have not had a concussion, does it still help them? Like I said, I do believe that answer is going to be a resounding yes. I just don't know that for sure yet because it hasn't been studied.
Thank you. So I guess the answer is when you fit that patient, then let me get you the case study form for it.
Exactly.
So, all right. That's why this is so exciting, guys. I mean, I don't know if you can hear the excitement in our voices, but we really believe that we're just scratching the surface for all the patients this can help. And that is the motivation here. This is a product that can transform lives and take them out of the dark room and immediately enable them to go back to their normal life. So, again, we'll be in touch with you all, and I do have some forms for case studies, and we're really, you're getting in on the ground floor of something amazing, and we want to hear your feedback and how the results that you're getting. So the next one was, says, I do prescribe prosthetic lenses. I wish to know how ALTIUS could help, and to my earlier question. So unfortunately, most of these questions are coming in anonymous.
I'm guessing this is the albinism question.
I'm thinking, and I actually have a picture of a case study that was done for a prosthetic. So I'm going to share my screen, and hopefully this will work. We're over time anyway, so anyone that stayed, you're getting the after hours. No, let me see. I want to show you. Okay, so as you can see here, that is just the gray-green contact lens. So, for certain patients, it could be a great option for a cosmetic lens fitting based on the patient's eye color. So this was a situation that it worked out really well, and it was a much more affordable option in a daily disposable.
If you're talking about the albinism with the prosthetic lenses, of course, having an opaque iris is still going to give you that pupil response that you're not going to get from the ALTIUS. But I do also think that for some patients, again, those are not going to be a great option, just either because of cost or the actual, just because I fit some patients in those as well. And sometimes it's difficult to get them to where they're comfortable for the patient. That eye is not always the most comfortable for those patients anyways. So sometimes that makes it a little bit different. And it might be one of those where either in conjunction or try the ALTIUS to see if you get as much of a response. So that would be my thought, is that it's still going to be tricky with the pupil part, but I do think there's some big drawbacks to the prosthetic lenses as well. So I think that's going to be determined type of situation.
That was really helpful. Thank you. So we only have 2 more questions. And I don't know what this is, so I apologize if I say it wrong, but Vuity drops a consideration. Yeah.
So if I remember right, the Vuity drops, it's one of the side effects is headache, I believe. correct? I think, sorry, I don't use the Vuity drops very much, to be completely honest with you. And that's one of the reasons I've kind of avoided it, because for my patients, I mean, their migraines and headaches is one of the big issues that they're having. So that's one of the things that I really haven't done a lot with. So I really do not have that, but I will say that it is not something that I use typically for my patients.
In regards to migraine patients, a lot of them have said that they love the ALTIUS because they no longer have to take their medication. So the only thing that I've heard from feedback is, you know, since I started wearing ALTIUS every day, I no longer have to take my medication on a daily basis. And that was like a huge push for them. So the only time I've heard that brought up was just like, it's so great because now that I'm wearing ALTIUS, I don't have to worry about that.
Yeah.
So that's one thing I've heard.
For me, with my patients, I would also worry about just their accommodative changes, because a lot of my patients struggle with that so much anyways, that I don't, since it's a different reason rather than just age-related presbyopia for my patients, I think that would be, I'm not sure how well that would work for them. For me, the other tricky part would be, you know, having work comp pay for something like that, because that's going to be a much harder sell for me than just having them do the tinted contacts where I can actually show what the patient is getting out of it. So that would be my answer to the Vuity.
Right. So can you get a pair of glasses with the same tint or try to trial it quickly? And I'll answer this one. So when this was developed originally for performance vision, that was a conversation that came up a lot. And unfortunately, so much of how this product works is the 360-degree tint immersion. So though, you know, the creators, Al Reichel and Carl Sitek, they tried to kind of simulate it, but unfortunately, that full immersion is what gives the product its edge. And so there is really no way to demo it outside of putting lenses on eye. And that is why, you know, we very quickly tried to create a program that you could be getting free demos for them to try in your chair. So the idea would be you'd be able to just take some Plano lenses, or, you know, you can pull prescriptions if you need to. But like 66% of our lenses sold are Plano. So a lot of these patients, and even the material we selected, which I'll send out to everyone afterward, our price sheet with our features and benefits. I should have put a slide in here for it, but it's going to have all the stats, you know, the material, the base curve, all of that. And we picked the material. I'm going to say this wrong because I'm coming from hard contact lenses, but because it's a little bit easier to handle. So you can handle the material, and it is easy for patients to wear who maybe even never inserted a contact lens.
Yeah, I did have a patient actually ask me this exact same question Monday. And I kind of explained the same thing to her, that it's not, for this contact, it is the tint color that helps a lot, but it's also just the full, you know, corneal coverage that is helping, making a big difference for them. So I had actually told her that no, there probably wasn't anything that would actually simulate what these contacts do. As far as for a true trial of it, I think the contact is really, because it is so different as far as the errant light, I think the actual contact trial is the only way they're going to really be able to get a good, true, accurate reading on it.
Okay, great. So the last question is, what is the suggested retail price for a 10-pack? So that MSRP is our suggested retail. So we suggest $30 for a 10-pack. 85 for a 30-pack, and on from there. In regards to, yeah, so I think that's the end. And I wanted to just say, so the material that it comes in is the OcuSilicon D, and it's a base curve of 8.7 with a 14.2 diameter. And again, these are going to come in a Plano to -6 in quarter steps. We just missed, it goes from Plano to -50 and then up to -6. There's one more question that came in on social media about using this as a substitute for transition lenses for people who have excessive screen time. Do you have anything to speak into that, Dr. Webster?
As far as in exchange of the transitions?
Yeah, but just because they're being discontinued. So if you were going to replace
the transition contacts. Okay, sorry, I was thinking I had transition glasses in my head. Yes, actually, I do think this would be a good one. The tricky part is going to be partly just what the lighting in environment is. As far as if they're going to feel like it's too dark, depending on where they're at with the contacts in. But yes, as far as and this is going to have better blue light blocking than the Transition or even the Oasis Max. For me personally, if a patient, I would give them the ALTIUS first, have them try that. The other thing, a lot of patients might need a couple of different kinds. So some of my patients, some days they might wake up, be feeling, pretty tough, have a rough day, and they might need the ALTIUS contacts. If they happen to wake up and have a good day, they might be able to, do an Oasis Max or something like that. But as far as switching the patients who've had transitions, yeah, I would absolutely try it, especially if they have that enough light sensitivity while they're on the computer that they felt like they needed the transition lenses. I think absolutely it would be worth trying. And for them, it might be worth trying a pair of each, the amber and the green, to see if where they're working, if one of the two actually works a little bit better for them.
Thank you for your valuable insight. It's so helpful. Great. Well, I know we're a little bit over time, so I won't keep you much longer. We really appreciate you joining tonight. I put on the direct emails in regards to kind of next steps. We recommend starting with our basic performance center, which gives you immediate dispensability for a very small investment. And we extended our 10% off for GSLS attendees to this webinar. So anyone attending the webinar tonight is eligible for a 10% discount off of both of our performance centers, which would bring the basic performance center down to, I think, $359, which again is going to give you 24 dispensable 10 packs and then a 90 pack of free demos to get you started. So it's a phenomenal deal. You'll immediately have that 90 pack of free demos that you can use in the office, or again, dispense a pair for them to try in the environment that they're getting it for, as well as sellable product to give them immediate dispensability. So we also have a really great in-service that myself and my associate Josh can give in your office. So it's going to go much more into the science of ALTIUS contact lenses and why they work. So we really wanted to hear Dr. Webster's experience in clinic, but the presentation that we can give to you after this is going to go more into the science of the lenses themselves. So please, we'll be reaching out and giving you a link to contact our calendars directly and to schedule that in service. So thank you for joining. We really appreciate it. Please join us again for our next webinar, which will be March 27th, featuring Dr. Kathy Weiss. Have a wonderful evening, and we will be in touch.